It's something that people are calling for. First of all, it's needed because, as I said in our committee the other day, and as was quoted by VT Digger, our healthcare system is a village on fire. We are seeing providers who are working so hard to bring the healthcare that people need to Vermonters, and they are struggling so much to be able to do that. And we need to be able to support them in doing that, and we also need to be able to support Vermonters in being able to access the care that they need. One of the things people often talk about the idea of perhaps rationing care or how much care would cost or something like that. But what I always say is that we already have rationing of care in our system. The rationing of care in our system is financial, whether you can afford it, and it's also a question of whether you have access to some sort of either employer-sponsored plan or other plan that you're able to take advantage of. And even then, so many Vermonters are underinsured. They have the health insurance plan, but the deductibles are so high that they can't do anything with that plan. We need a healthy Vermont. In order to have a healthy Vermont, we need everyone to be able to access primary care so we can have preventative care, so we can interdict early when it comes to preventing suicide, other mental health issues, and we also, again, need to support our providers. And bills such as these support Vermonters, support providers, and fulfill the promise that we have in order to promote a healthy Vermont. And we took testimony from the Green Mountain Care Board just this morning, where near the end the person said, we've heard people say that our healthcare system in Vermont is a village on fire, but what we need to understand is that it is a nation on fire. And so Vermont can't operate in a vacuum. There are many, many factors that contribute to the problems that we are seeing with the healthcare system in Vermont here today. And unfortunately, many of those problems are nationally based that we do not have control over. However, this is something that we do have control over. And if we have the ability to have control over this thing and to make a step that will contribute to the health of Vermonters, then I think it's something that's utterly necessary. To me, this is a moral issue. This is a moral issue because we can't have people suffering and dying simply because they can't afford their health care. We can't have that. In a civilized society such as ours, in our brave little state of Vermont, we need to make sure that everyone has access to the preventative health care that they need. I also would say that this is an economic issue. I have had constituents come to me, business owners, people who own farms, who have come to me to talk about health care, and they've said, why can't we just have Dr. Dinosaur for everyone? They say, I'm losing workers because I can't provide health care. I'm not in that business. And so I'm losing workers to other employers who have the ability to provide employer-sponsored health care plans. And so if we were to have universal primary care, we put our small businesses in Vermont, we put our small rural businesses in Vermont on the same level as larger businesses who are able to promote these plans. And the Vermonters can have the choice of where they want to work that's not dependent upon the health care plan that they get. It is dependent on where they can get the best wages, where they can be doing work that is rewarding to them, and other factors that they're considering when it is coming to their employment choices. So let's put our small rural businesses on the same level as our large businesses that are able to offer healthcare. Let's allow them to be vibrant businesses by giving them giving their workers the same opportunities that workers for larger businesses have. And so that's why I'm supporting this bill, because I believe that it is a moral issue, and I believe that is an economic issue. And as I said, I believe it will support providers, because I have heard that this is something that would attract providers to Vermont, attract primary care providers to Vermont. And if that research does bear out to be true, how great would that be for our system to be able to bring more primary care providers in, to be able to expand the base of that program, and to promote healthier Vermonters who are able to access the preventative care that they need in order to be healthy.